whenever we are discussing about any organ, usually we have to keep it in anatomical position first. So, if you wanted to keep heart in anatomical position, we should know some surfaces and some parts of the heart. See, this is the surface which is projected forwards. That means which is present towards anterior aspect. Since it is in relation with the sternum and ribs and their costal cartilages, this surface we can also call as sternocostal surface. So this surface is sternocostal surface. And here this projected part is there. This projected part what we are calling apex. So this is apex. This is sternocostal surface. And this is behind. This posterior surface or this posterior part we can also call as base. This base should be directed backwards. So we have to keep like this. Then this is the left surface towards left side. And here this is the surface which is resting over the diaphragm like this. Imagine this is diaphragm. This is resting over the diaphragm. So this surface what we are calling diaphragmatic surface. Right? So if you wanted to keep this heart in anatomical position, you have to keep diaphragmatic surface on your palm. That means imagine this is diaphragm. So this is diaphragmatic surface. I am keeping over the diaphragm. And this is apex. This apex should be directed forwards, downwards and towards left side. When you keep heart on your left palm, you have to keep the apex in between your thumb and index finger. So if you keep like this, this is anatomical position. Apex is directed downwards, forwards and towards left side. And this is base. This base is directed upwards, backwards and towards right side. Diaphragmatic surface on your palm. Sternocostal surface anteriorly. Left surface towards left side. So this is the anatomical position of heart. Then what are the external features of heart? It is having some presenting parts. So we have to discuss about those presenting parts. As we know, this is apex and this is base. This posterior part, this is base. And this surface is sternocostal surface. And this surface towards left side, this is left surface. And this is the surface which is present over the diaphragm, diaphragmatic surface. Right? And we have some borders also. This is superior vena cava opening. This one is superior vena cava opening. And this is inferior vena cava opening. If you make one line extending from superior vena cava to the inferior vena cava, this line what we are calling right border. This border is right border. Then this is inferior border. This is inferior border. Towards the apex of heart, inferior border is indented by one notch here or one indentation here. This indentation what we are calling incisura apicis cordis. That means inferior border is cut by anterior interventricular groove, so that this indentation has been formed. This indentation what we are calling incisura apicis cordis. This is about inferior border. Then if you observe towards left side, there will be ill-defined. It is not defined properly. Ill-defined left border will be there. This ill-defined left border separating the sternocostal surface from the left surface. Ill-defined border is there. This ill-defined border separating the sternocostal surface of the heart from the left surface. Right? Then what about this inferior border? Inferior border separating the sternocostal surface from the diaphragmatic surface. Is it? Then here this is right border. Right border separating the sternocostal surface from the base, or base we can also call as posterior surface. So right border separating the sternocostal surface from the base. Right? So these are the different borders. Actually superior border also they will say which is present along the upper margin of atria. Along the upper margin of atria they will say that superior margin, or this is superior border. If you see inferior border we can also call as margo acutus. Then left border we can also call as margo obtutus. Margo acutus and margo obtutus. Okay. These are the different presenting features. Now we have to discuss one by one. First, this is apex. Apex is directed downwards, forwards and towards the left side, and it is present at the fifth intercostal space. Actually, if you observe the ribs, in between the ribs there will be intercostal space. So if you count from above downwards, there will be fifth intercostal space. Apex is present at the fifth intercostal space, 9 centimeters from the midline. Midline to 9 centimeters towards left side. Then just medial to the midclavicular line. You know the clavicle. This is clavicle. If you make one line along the middle of the clavicle, that line what we are calling midclavicular line. Just medial to the midclavicular line and 9 centimeters from the midline in the fifth intercostal space. That is the exact location of apex. So apex is located at the fifth intercostal space, 9 centimeters from the midline, just medial to the midclavicular line. But some books they will tell that just below and medial to the nipple. But nipple is not reliable guide because it varies from individual to individual and it varies from gender to gender. So that's what we cannot rely on nipple, right? So this apex will be covered by left lung and its pleura. Apex will be covered by left lung and its pleura. So these are the relations and location of apex. Then this is what? Base. This is the base. This base is most fixed part of the heart. Base is most fixed part of the heart. This is apex, no? This apex directed downwards, forwards and towards left side. And it is formed only by left ventricle. See, this part is left ventricle. Apex is formed only by left ventricle. Right? Then this is base. Base is directed upwards, backwards and towards right side. See here, base is directed upwards, backwards and towards right side. So this is base. Base is most fixed part of the heart because the remaining part will be moving during systole and diastole. But this base will be fixed. And this base is present in front of the posterior mediastinum. So what are the structures which are present in the posterior mediastinum? Those structures are related with the base. Those are bifurcation of trachea, esophagus, aorta, azoigus vein, hemiazoigus vein, splanchnic nerves and vertebrae, 5 to 8 thoracic vertebrae. It is present opposite to the 5 to 8 thoracic vertebrae in the lying down position. In the lying down position, base is located opposite to the 5 to 8 thoracic vertebrae. Opposite to the bodies of 5 to 8 thoracic vertebrae. But in the standing position, it descends one vertebra down. That means 6 to 9 thoracic vertebrae. It is present opposite to 6 to 9 thoracic vertebrae. So these are the relations of base. Very simple. Base is fixed part. Base is formed by both atria. See, this is the left atria and this is the right atria. This is left atrium and this is right atrium. So these both atria will form the base. That base is most fixed part. Posteriorly it is related with, if you wanted to say specifically, here one sinus is there, oblique sinus. Oblique sinus. Then bifurcation of trachea, esophagus, aorta, splanchnic nerves, azoigus vein and hemiazoigus veins, 5 to 8 thoracic vertebrae. What are those vertebrae? 5 to 8 thoracic vertebrae in the lying down position. But in the erect posture, it descends one vertebra down. So that 6 to 9 thoracic vertebrae. It is present opposite to 6 to 9 thoracic vertebrae. So this is about base. Then what is this surface now? This surface is sternocostal surface. Sternocostal surface is formed by, what are the parts? See here, this is the right atrium. This is right atrium. Right atrium having one ear-like projection. This ear-like projection, what we are calling auricle. So right atrium, right auricle, right ventricle, left ventricle, and small projection or ear-like projection from the left atrium. See, this is the left atrium. From the left atrium there is ear-like projection. This ear-like projection is left auricle. This is left auricle. So sternocostal surface formed by right atrium, right auricle, right ventricle, left ventricle, left auricle. So all these will form the sternocostal surface. Right? Then what are the relations of it? It is in relation with the sternum, costal cartilage and ribs along with that intercostal spaces. All these together will form the anterior chest wall. Anterior chest wall is formed by sternum. See there, sternum is there, ribs are there, and in between the ribs intercostal spaces are there. So there is anterior chest wall here. Here is heart. In between heart and anterior chest wall, there will be lungs and pleura. In case of right side, right lung and its pleura. In case of left side, left lung and its pleura. anterior relations are anterior thoracic wall, right and left lungs and their pleura. But in case of right side, anterior border of right lung is totally covering like this. But in case of left side, anterior border of left lung, when it reaches to the fourth intercostal space, it will be deviated towards the left side. If you wanted to say exactly 3.5 centimeters lateral to the lateral border of sternum. So that this area will not be covered by left lung and pleura, this area. Because left lung is forming the cardiac notch. Because of that, this area is present immediately behind the sternum. That to which part of sternum? Left part of the lower two pieces of sternum. So it is exactly present behind the sternum and their corresponding costal cartilages. So this area what we are calling area of cardiac dullness. So that is about sternocostal surface. Very simple. Sternocostal surface is formed by right atrium, right auricle, right ventricle, left ventricle and left auricle. And sternocostal surface in relation with the anterior chest wall separated by right and left lungs and their pleura. So this is sternocostal surface. Then this is left surface. This left surface separating from the sternocostal surface by ill-defined left border. So this border is left border and this surface is left surface. Left surface is present towards the left side and this left surface related with the mediastinal surface of left lung, because here lung will be there. Mediastinal surface of left lung. Phrenic nerve, pericardiaco-phrenic vessels. Phrenic nerve and pericardiaco-phrenic vessels. So these are the left surface relations. And this left surface is formed by left ventricle and part of the left auricle. Left auricle also forming the left surface. This is about the left surface. Then what is remaining? Diaphragmatic surface. See, this is diaphragmatic surface. Diaphragmatic surface is resting over the diaphragm. It is present over the central tendon of diaphragm. Below the central tendon of diaphragm, what will be present? Liver will be present. So diaphragmatic surface related with central tendon of diaphragm and liver. First central tendon of diaphragm will be there. Below that liver will be present. Okay. If you wanted to say specifically, not only central tendon of diaphragm, even the some muscular part of the left dome of diaphragm also related with the diaphragmatic surface of heart. But you people remember, diaphragmatic surface related with the diaphragm and liver. That means below this diaphragmatic surface, diaphragm will be present. Below the diaphragm, liver is present. Is it? So this is about different surfaces. Now we have already discussed about the borders. Right border extending from the superior vena cava to the inferior vena cava. Along the right border, we can see one sulcus. Here you can see one sulcus. This sulcus what we are calling sulcus terminalis. This sulcus what we are calling sulcus terminalis. If you cut the atrial wall and if you see inside the right atrium, where the sulcus terminalis is there, no, opposite to the sulcus terminalis, inside we can see one ridge. That ridge what we are calling crista terminalis. This is sulcus terminalis and here inside crista terminalis. That is about right border. And this is inferior border. Inferior border is separating the sternocostal surface from the diaphragmatic surface. And it is having one indentation. That indentation what we are calling incisura exis cordis. Then left ill-defined border separating the sternocostal surface from the left surface. With this we have seen the external features. But to remember easily, I will tell you two formulas. One is 2/3, 1/3 formula and another one is only features. Sternocostal surface is formed by mainly two ventricles only, but small contribution by right atrium, right auricle and left auricle also. But main contribution is by right ventricle and left ventricle. But how much contribution? See here, this contribution is more. Right ventricular contribution is more. Left ventricular contribution is less. So 2/3 by right ventricle, 1/3 by left ventricle. Sternocostal surface is formed by 2/3 by right ventricle, 1/3 by left ventricle. Then this is diaphragmatic surface. This is diaphragmatic surface. If it is diaphragmatic surface, which one is giving more contribution to it? See here, this part is more. So diaphragmatic surface is formed 2/3 by left ventricle, 1/3 by right ventricle. 2/3 by left ventricle, 1/3 by right ventricle. Then this is base. What is this? This is base. Base is formed by two atria. left atrium and right atrium. But 2/3 by left atrium, 1/3 by right atrium. 2/3 by left atrium, 1/3 by right atrium. Then, if you see the heart in position wise, heart is not exactly present in the center and not present in the left side. People will tell that heart is present in the left side. But it is not exactly present in the left side. Heart is present 2/3 towards the left side, 1/3 towards right side from the midline. From the midline, heart is located 2/3 towards left side, 1/3 towards right side. Is it? So this is the position. These are the 4 features which bears the 2/3, 1/3 features. Recollect. Sternocostal surface formed 2/3 by right ventricle, 1/3 by left ventricle. Diaphragmatic surface formed 2/3 by left ventricle, 1/3 by right ventricle. Base is formed by 2/3 by left atrium, 1/3 by right atrium. Position wise, heart is located 2/3 towards left side, 1/3 towards right side from the midline. Then only features. See here, this is apex. Apex is formed only by left ventricle. Then base. Base is formed only by atria. Only by atria. Atrium is both right and left atria. Then diaphragmatic surface formed only by ventricles. Diaphragmatic surface formed only by ventricles, right and left ventricle. Then right border is formed. This is right border. Right border is formed only by right atrium. So these are the only features. With 2/3, 1/3 formula and only features, we can discuss almost all external features of heart. Should I repeat only features? Only features. Apex is formed only by left ventricle. Base is formed only by atria, both right and left atria. Diaphragmatic surface formed only by ventricles, right and left ventricles. Then right border formed only by right atrium. Then here there will be some grooves. Some grooves are there. Those grooves we should learn. Then only we can understand the blood supply of heart, or course and relations of right and left coronary arteries. If you wanted to discuss, we should know what are the different grooves are present in the heart, because through that grooves only these blood vessels are going, or these blood vessels are passing. Right? See here, there will be grooves in between the chambers. See, these chambers are ventricular chambers. These chambers are atrial chambers. These are atrial chambers and these are ventricular chambers. Groove between the ventricle and atria. This groove, what we can call atrio-ventricular groove. Atrio-ventricular groove. This groove, what we are calling atrio-ventricular groove. It is present in the anterior aspect. That too right side. Anterior aspect and right side. Then it is present in the posterior aspect. Then it is extending towards the left side and anterior part. Left side and anterior part. So it is like C shape. See here, it is like a C. It is having right anterior part, left anterior part and posterior part. Why it is not circular? Because infundibulum, right ventricle and the pulmonary trunk extending up, and it is visiting the circles, so that it became C shape. So it is having right anterior part, left anterior part and the posterior part. Let me show you that. This is this sulcus. This sulcus is right anterior part. This is posterior part. And this is left anterior part. This is left anterior part. Is it? So this sulcus, what we are calling atrioventricular sulcus or atrioventricular groove. We can also call as coronary sulcus. Coronary sulcus. Then some other grooves also there here. See, this is one ventricle, this is one ventricle. It means right ventricle, left ventricle. In between this groove is there. This is the groove. This groove is present in the sternocostal surface. That means it is present in the anterior surface. So this groove, what we are calling anterior interventricular groove. This groove is anterior interventricular groove. Then if you see in the diaphragmatic surface, here also one groove is there. This groove is present in the posterior aspect. That too, it is present in between the two ventricles. So this groove what we can call posterior interventricular groove. Posterior interventricular groove. Is it? So this groove is posterior interventricular groove. Right? Actually, anterior interventricular groove cuts the inferior border at the incisura epicis cordis and continues as posterior interventricular groove. Then, this is right atrial chamber. This is left atrium. Here we can see one groove. This groove, where this septum is attached. Intraatrial septum is attached here. So here we can see one groove. This groove is interatrial groove. This groove what we are calling interatrial groove. See here, atrioventricular groove, interventricular groove and interatrial groove all are meeting at this point. This point what we are calling crux of heart. CRUX, crux of heart. This is the meeting point of all sulci. This is about the different sulci which are present in the heart. These sulci are formed because of attachment of corresponding septa. That means if the interventricular groove is there, deep to that there will be attachment of interventricular septum. If it is atrioventricular sulcus means there will be attachment of separating septum which is separating the atria and ventricles. If it is interatrial groove, deep to that there will be attachment of interatrial septum. In this way these grooves are formed. If you know about these sulci, then only you can understand the course of blood vessels. That we will discuss little later. These are the external features of heart.